Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So as of this morning, we have a total of 1,938 cases. This is an increase of 192 cases since I reported a week ago on November the 17th. And at that point, I reported that over the week before, we had 190 cases. So we're up slightly from the previous week. I also regret to inform you that we've had 2 deaths over the past week. One was a man in his 80s who passed away at Georgian Bay General Hospital. Another is a woman in her 80s who passed away at a congregate setting. So I would like to express my condolences to the family members for your loss. So far this week, we've had 104 cases since Friday. So 77 over the weekend, and then 29 on the course of the day yesterday. So if we look at the last 29 cases, 25 of them are sporadic, 2 were in educational settings. Just ask if people could mute your line, please. I can hear some music in the background. I think perhaps we're on mute by somebody. Kathy Dermott?
Yes.
What would you advise? Sometimes it's necessary to re-phone in to have that come to an end.
Okay, let's do that right now then. Everybody, you could hang up and we'll all phone in and start over again. Thank you.
Okay, and to my viewers, I apologize for this delay. We'll be starting in a moment.
Please enter your conference ID followed by pound. Thank you. The moderator has not yet joined the conference. If you are the moderator, please press star now.
Your phone on mute, but also do not put us on hold. If you're being called, please call back instead of putting us on hold. Thank you. So if we look at the last 29 cases over the last day, 25 are sporadic, 2 are from educational settings, 2 from congregate settings, 16 are male, 13 female. Their ages range from under 10 to over 90. 28 are from Simcoe County and 1 is from Muskoka. 2 are community acquired, which means we weren't able to link them to an identifiable source. 4 were close contacts of a known case, 19 are under investigation, 2 are associated with an outbreak in educational settings, and 2 are associated with outbreaks in congregate settings. All of them are self-isolating, so none of them are admitted to the hospital. So we have a total of 218 active cases right now, and this is up from 207 a week ago. And that means we have a total of 1,659 cases that have recovered, and this is up from 1,476. Right now we have 15 cases in hospital, which is up from 7 a week ago, so that is quite a large jump. The ages range from in their 40s to their 80s. All are from Simcoe County. 2 are in the intensive care unit. We have 11 at RVH, 3 at Southlake Regional Health Center, and 1 at Mackenzie Health. So currently we have 12 outbreaks, which is unchanged from when I reported last. 4 of them are in institutions, which is actually down from 6 a week ago. So 2 of those are declared over. The Waterford Retirement Center in Barrie and at IOF in Barrie. 2 are at congregate settings, which is up from 1 a week ago. So 2 are in group homes in Simcoe County. I beg your pardon, 2 are as follows. 1 is in a group home in Simcoe County, and 1 is in a congregate living center in Barrie. And then we have 1 group home outbreak in Simcoe County that's declared over. We have 2 outbreaks in workplaces, which is unchanged from a week ago. So 1 is in manufacturing and 1 is in food service, both in Simcoe County. That food service location would actually be the McDonald's that I spoke to in Angus that had self-reported, and thus I am able to speak to the name. We have 1 outbreak declared over at a manufacturing center in Simcoe County. We have 4 outbreaks in educational settings, which is up from 2 a week ago. So 1 is over, and that is Our Lady of Grace Catholic School in Angus. We have 2 secondary school outbreaks, 1 at the Nottowasega Pine Secondary School in Angus and 1 at St. Joan of Arc Catholic School in Barrie. And we have 2 elementary school outbreaks, 1 at Warnica Public School in Barrie and 1 in Willow Landing Elementary School in Barrie. So we can continue to see much the same pattern as we've seen with this throughout the second wave, and that is outbreaks and clusters involving families, households, sometimes more than 1 household, but a single family, extended family from connections and gatherings of those family members, and then connections from there into work environments, so workplace outbreaks. There's a concentration of cases in southern Simcoe, and some of that is related to people working or socializing south of Simcoe into the Greater Toronto area, where you have much higher rates of transmission than we've had here in Simcoe County. So that's the connection with the south for South Simcoe. But Barrie as well certainly has had its cases. I've spoken before about Angus, and so Essa Township. All of this speaks to the importance of control measures in place being followed in the work environment, being maintained by the employer. And with regards to the outbreaks in home settings, we do advise that people get tested early. If you develop symptoms, isolate from your family members and go get tested right away. And that way you have a much better chance of being able to prevent spread through the household than if you leave it later. And certainly people need to stay to their household when it comes to close contact. We also have an outbreak involving a hockey team in Barrie with youth, and so that is something new for us. That's we've seen it before in workplaces, we've seen it in restaurants and households, but now we've got this as well as something else. So I think that that's important for people to be aware of. That's still under investigation right now, and we will certainly learn more about the dynamics behind that and the connections involved as well. But at this point, I'm highlighting that particular finding. So with regards to our schools, we have since September had a total of 108 sporadic cases. So people becoming infected and then going to school, which is not the same thing at all as transmission in school. However, we continue to have some outbreaks in schools as well, as I've highlighted. A total of 4 educational settings at this time. So once again, it's very important for people to screen your children before they go to school, or youth to screen yourself and not to go to school if you develop symptoms, and they go get tested instead. And I would also emphasize that what people do after school is very important as well. So back to sticking to your household for close contact. You may be seeing your friends at school, but afterwards you need to be physically distancing to avoid transmission that can then be brought into your home or be brought back to the school. With regards to our dashboard, we remain in yellow status for our health units dashboard, and this is to be differentiated from the province's framework. They're 2 different tools. So we created our dashboard before the province created its framework. They're for different purposes. Our dashboard is meant to give us, at a glance, an overall sense of how much disease transmission is happening here, and what impact it's having on the healthcare system, what impact it's having on our public health system. It follows a green, yellow, and red designation, and it has 4 subcategories within it. And that's different from the framework from the province, which is really meant to determine what public health measures need to take place in any one health unit looking across the province. So if we look at our dashboard, we're in yellow, and we continue to have a red alert with regards to virus spread and containment. Although it is good news that over the past week our case count did not rise greatly compared with the week before, so that's certainly good news. But it's still high, and we still have a reproductive number that is above 1, so 1.2. Anything above 1 means that it's growing. We still have a high number of outbreaks as well at 13. With regards to laboratory testing, we're on a yellow designation, and that's because we have a high percent positivity, now 2.1. So anything above 3 is definitely of great concern. We're below that, or below the provincial average. But we've been rising compared within the past. So the higher that number, the greater the number of cases per test that's being done. We are in yellow status with health system capacity, and that's because we have a high bed occupancy in our hospitals, and that's remained the case for the entire time that we've had this dashboard. So that hasn't really been related to COVID cases driving that number. It's really just healthcare utilization, the provision of care. But our acute care bed occupancy is 86.5, and so we've noted, therefore, that we're in a yellow status. And with regards to our public health system capacity, our ability to do case and contact management still remains in yellow, not changed appreciably from the past. We are getting to 86.2% of all of our cases within 24 hours and 82% of our contacts, but we are striving to be above 90 for both of those categories. So hence the overall designation for the dashboard of yellow status. In terms of our trajectory, the fact that we've not gone up a great deal over the past week compared with the week before is good news. In fact, we've got a weekly incidence rate of 30.4 cases per 100,000 population per week, compared with the previous week of 30.1 per 100,000 population per week. We were, up until perhaps 3 weeks ago, following an exponential growth curve that, of course, was very concerning to me because that means, repeated doublings of cases over time. And I'm happy to say that since the past 3 weeks, we've diverted from that curve and we're leveling out more. And had we continued on that curve, by this point we would have had an incidence of 50 cases per 100,000 population per week. So certainly 30.4 is much better than 50. And our average daily growth rate is slightly down from the previous week. So at this point it's 1.5% versus last week it was 1.6%. I also note that the average daily growth rate in the province as a whole is slightly down from what it had been. So for Ontario, 1.4%, and the previous week, 1.7%. So it's good news for us, and it's good news for the province. The doubling time is also slightly down, slightly up, which is a good thing. You want a longer doubling time. So for us, it's 49.4 days, whereas last week it was 44.7 days. I would also point out that the province's case count incidence per week is slightly down from the previous week. So this past week it was 64.6, which is more than twice what we have here, but slightly down, perhaps significantly down from the previous week at 71.3. So it looks like there's the beginning of hope, I would say, both for us and for the province. But of course, we need to keep up our control measures, and that means everybody needs to keep up their own efforts to protect yourselves and protect your families and avoid transmitting to others, doing all the things that I always say, the physical distancing and self-monitoring and close contact with your household only, or if you live alone, adopting one other household for close contact, and seeking assessment and testing if you develop symptoms, and wearing a mask if you're in indoor public spaces or in a work environment that requires it. With regards to our outbreaks, a little bit more detail. Simcoe Manor in Beaton continues with the same case count unchanged from last week, a total of 76 cases. And we've had 10 deaths at that site, but that is unchanged. And otherwise, we're awaiting final test results, but very close to that being declared over. Allendale Station Retirement Home in Barrie remains unchanged in its case count, with 3 residents and 3 staff, and negative test results for those in that facility. Sunset Manor in Collingwood now has 2 positive staff cases, up from 1 a week ago, and 1 positive resident. Otherwise, test results for those at the facility have been negative. Holland Gardens retirement resident in Bradford, outbreak declared on November the 13th. 1 positive staff member, unchanged from when I reported a week ago, and negative test results for those at that facility. In terms of the educational settings, the Nottawasaga Pine Secondary School in Angus now has 8 positive student cases, up from 5 a week ago. We have a total of 162 high-risk contacts that are on self-isolation, and have run 3 testing clinics in order to facilitate testing for those involved. The Warnica Public School in Barrie had an outbreak declared on November the 21st, with 3 student cases involving 29 high-risk contacts in self-isolation. Willow Landing Elementary School in Barrie had an outbreak declared on November the 22nd. And in that outbreak, there were 2 staff cases and no student contacts. Other staff contacts have been notified and tested and are in isolation. St. Joan of Arc Catholic Secondary School in Barrie had an outbreak declared on November the 23rd. They have a total of 7 cases, 4 students, and 3 staff members, with a total of 62 high-risk contacts in self-isolation. In terms of our congregate setting outbreaks, we have one group home in Simcoe County, an outbreak declared on November the 19th, with 1 staff member and 1 resident being positive and the others negative, and being managed, staff contacts being managed in self-isolation. We have a congregate living facility in Barrie that I've spoken to before. It was declared, actually I've spoken to it before, but not a week ago. It was in an interview at the grand opening for the pandemic response unit at RVH. So their outbreak was declared on November the 17th, and they have a total of 9 residents that are positive, including 1 who passed away, and 3 positive staff members and 1 positive visitor. Okay. So, a few key messages in terms of the province's framework. We are presently in orange restrict status as a district, the health unit and the municipalities within the health unit. So in terms of what this means, it includes the following: that for restaurants, bars, and other food and drink establishments, meeting and event spaces, at tables, they are limited to have 4 people, down from 6 when we were in yellow status. The facilities cannot hold more than 50 patrons, or persons, actually, capacity of 50 persons. And there has to be a minimum of 2 meters between tables. The hours are further restricted compared with in yellow status, including the hours in which a liquor can be sold. In terms of retail, there's limiting capacity in retail stores and shopping malls in the winter, and screening of patrons entering at malls for symptomatology. In terms of personal care services, services that are provided to the face are now prohibited. Change rooms and showers are closed. Bathhouses, adult venues, hot tubs, floating pools, and sensory deprivation pods are closed. And screening is required for the patrons with regards to their symptoms. Casinos, bingo halls, and gaming establishments, there's some restrictions with regards to the hours of sale of liquor, and screening of patrons with regards to symptoms is required. So with the profile of our epidemiology right now, I believe that we still belong in orange status. I do not anticipate a change to another level such as red, as long as that persists. So we'll have to see if that persists, or if it changes for the worse, or if it changes for the better. Certainly, I think it's up to us all to do all that we can to continue to flatten the curve and bring it back down again. I'm putting out a special statement to you, the residents of Simcoe, Muskoka, basically reinforcing some of the key messaging that's within the province's COVID response framework. And it's really all about the messages that I've been saying pretty well all along, particularly in the second wave, that you need to limit yourself to your household, for close contact, or for people who live alone to adopt one other household for close contact, and otherwise maintain 2 meters distance from other people. That includes other family members. You need that distance. You need to be wearing face coverings when you're in indoor public settings, when you're in work settings that are required, and if you cannot physically distance. Virtual gatherings are the safest way for people to be together, and if you think ahead about the upcoming Christmas season or holiday season or Hanukkah, that's an alternative that would be much safer for gatherings with family members. Outdoors, there are limits, gathering limits for outdoors and indoors, and you need to maintain the physical distancing. So you need to adhere to the outdoor limit of 25 persons or the indoor limit of 10 persons, and I would suggest best to do it outdoors or remotely instead. Travel within Ontario, the province is advising that people not travel between the levels, between the colored zones. So those from red zones or gray zones, there's a strong recommendation that you not come here unless you have an essential purpose of some kind. And although the document doesn't define essential purpose, in my mind that would be work or accessing healthcare services or other critical government services, or commencing education, that type of thing. And so ourselves here in the orange level, we need to think in terms of this as well. It's wise that you not go into the higher levels, and that if you do so, be for essential purposes only. And same with going into a lower level, a green level or a yellow level area, that you shouldn't be doing that unless you have an essential purpose of some kind. There's content here about interprovincial travel. And I note of interest that they actually recommend, the province, and therefore in my note, recommend self-quarantine or drastically reducing close contact with others 10 to 14 days before traveling and after returning home. So this is travel that is interprovincial, not just international. If you travel internationally, you're required by the Quarantine Act to quarantine for 14 days. So that's not a recommendation in that instance, that's a requirement. And then people need to consider the risks associated with travel before determining whether or not they really need to do that kind of travel. And so also recommendations about staying home if you're unwell and seeking testing, about hand hygiene, about covering up when you cough, downloading the COVID Alert mobile app as a way of tracking to see if you've been in close contact with somebody who becomes a case, and getting tested if you have symptoms that are compatible with COVID-19. I'm also issuing a letter today to our municipalities. And in this letter, I'm noting the province's concern and advice about travel to our area from the red or gray zones. From most of the Greater Toronto area is in red, and Peel and Toronto are in the gray lockdown zones. And I'm advising strongly that people from those areas only come here for essential purposes, and not come here in order to access recreational facilities that are provided by our municipalities or other services or shopping. I recommend against that strongly in order to help reduce risk of transmission of COVID-19. If you come here and you meet with others, there's a potential for you becoming a case or they becoming a case. There's a potential for transmission to people who actually live here. So I am urging that you not do that. And in my letter to the municipalities, I'm advising that they disallow people from the red or gray zones from using the recreational facilities of those municipalities. So that'll be up to the municipalities whether or not they would take my advice or how they would apply my advice, but I am providing that advice at this time. I'm also going to be issuing a letter to businesses and organizations as employers. So this will be within this week. And this letter will be a letter of instruction, so it carries legislative weight. It is enforceable. And this is meant to address workplace transmission that we continue to see, address the lapses that we've seen that have been associated with that transmission. And so in my letter of instruction, I'm basically referencing what's already required under provincial legislation, provincial regulation in these work environments. I'm basically restating what's required, but now that it's coming from me as a letter of instruction, it can be enforced by police, by bylaw officers, or by the health unit, whereas the legislation by itself from the province is only enforced by Ministry of Labor personnel. So it carries a greater potential for enforcement. And then beyond that, I've included some additional content. So one is that they enable remote work where practical for their employees as the safest means of conducting work, and that they appoint a compliance officer, somebody who's accountable at the work environment to systematically go through the work environment and make sure that all of the measures that are required are in place, and they do some form of tracking to make sure that it's all happening. So a point of accountability is what I'm requiring, or will be requiring once I get my letter out. But other than that, it's the usual content that employees are to be actively screened before they enter the work environment, that employers track absences of employees in order to investigate whether or not they may be a case, that they ensure physical distancing, that they ensure where practical, and face coverings, barriers as a means of reducing transmission. All of this is just meant to help address the transmission that we're seeing in the work environment. So I've had the following questions from the media. If the new restrictions imposed by the province don't bring the numbers of cases down, can we expect Simcoe, Muskoka to be in lockdown in a month or by Christmas? So I did note that over the past 2 weeks we've seemed to have leveled. That may change. It could go back up again if we're very fortunate, and if we work hard at this together, that'll be the beginning of it coming down again. So that's cause for hope. And I've also noted that we've deviated now from exponential growth, that we're now leveling out while that growth pattern would have been going up. And instead of having an incidence of 30 cases per 100,000 population per week, we'd have 50 per 100,000 per week. So that's good news. But if we aren't fortunate, and if we can't work well together on this, then indeed we could go back up. We could continue to grow. We could very easily surpass the threshold for the red level, the control level, which is only 40 cases per 100,000 per population. That's not a big jump from where we're at 30. We could easily end up there for unfortunate or not careful. Getting into lockdown is not precisely defined. There's some broad language in the framework that speaks to continuing case elevation despite putting in place the control measures in red. That too is certainly possible for us if we don't work this very hard together and if we're unfortunate. So it's possible that we could end up in red, it's possible that we could end up in gray, but we do have some cause for hope right now. What are the three hospital capacity rates like right now for just Simcoe County? So this is with regards to the dashboard that we have for the health unit. And I would say that the rates for Simcoe County would be very close to what you see in those dashboards, because it's data for Simcoe County and then Muskoka, and Simcoe County is much larger than Muskoka and would tend to have a bigger sway over those rates. So I don't have those figures at my disposal. I'll make some inquiries about it and see if we can get that. Are there hospitals in Simcoe County being overwhelmed are you concerned about the high occupancy rate of acute beds in the region right now? What I would say is that there's high occupancy in the beds in Simcoe County and Muskoka right now, Simcoe, Muskoka as a whole. But this is mostly unrelated to COVID-19. It's true that we've had a significant jump in the cases of COVID-19 over the past week. So that's cause for concern. And of course, hospitalization tends to lag behind the onset of cases. So if we manage to level our case count, we would expect hospital cases to trail behind and come up before they would level out and then decline. At this point, I don't think we're anywhere near COVID hospitalizations being a crisis or a challenge for us. But if we were to continue to grow with our cases, then that could happen. That certainly happened with gridlock south of here in the Greater Toronto area. So it's very important for us to work together very hard to avoid that. We also have RVH's pandemic response unit that is operational, and to me that's an extra 70 beds. That's additional capacity that was specifically established to help us manage a surge, a wave of COVID-19, future waves of COVID-19. I think it was very wise of us to have been able to proceed with setting that up. That's a resource for the district, and so that helps us be able to manage a surge of hospital cases if it comes to pass. The vaccine for COVID-19 appears to be closer than ever. Once it arrives in Simcoe, can we put aside social distancing, mandatory masks, and go back to life like it was before the pandemic? Well, I would say that, just like all of you, I very much look forward to the day that we can live normal lives again. And I do believe that the vaccine is absolutely critical to achieving that. And I'm very heartened with the news that has come out about the effectiveness of the vaccines, the trials that have finished to date or have had preliminary data to date, including 2 vaccines that are under order by the federal government of Canada. So they're vaccines that we will be using, and I'm heartened by the news that they will be available early in 2021, early next year, which is not very far off at all. Certainly for public health and the broader healthcare system, it's our challenge to get ready to deliver that vaccine to the population, and we're working hard on that and awaiting direction from the provincial government about the approach to that. We will need a high vaccination rate before you've got what we call herd immunity, where you have enough protection in the population, enough immunity in the population that you're disrupting the chain of transmission, and therefore the risk for everybody drops dramatically. So you have to have a high rate of vaccination for that to be achieved, probably 70% or more of the population needing to be vaccinated before we can achieve that. And that's going to take us some time. From what I see of communications, it could very well be through the year, through 2021, getting supplies of vaccine over time and then administering it to the population, working through priority groups from those at highest risk and those who provide care to those at greatest risk, down the priority listing before we can get up to that 70 plus or 75% coverage rate. And these vaccines, at least 2 that are coming forward now, require 2 doses. So that's all the more work for us, and all the more compliance from people to be able to get 2 doses to be assured of protection. So I feel confident that when we get through all of that, we will get to a point where we can bring to an end these control measures. I don't have a clear vision in my mind right now what that process will look like. It'll still have to be carefully done, thoughtfully done, driven by data about the degree of risk that remains, the percent of the population that's vaccinated, the percent of the population with immunity, the patterns of transmission before we can take away all of those control measures, but I feel confident that someday they will be gone. So at this point, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. And so I just heard a little message saying that you're sounding a bit muted on Facebook. So if you could just speak up a bit when you answer the questions, that would be fantastic. So let's start with Erica Engel from Barrie today.
Sorry.
Carnegie.
Yeah, sorry about that. The cases you're investigating relating to a Barrie hockey team, is this the first incident of spread of this nature?
It is the first time we've seen spread of this nature in Simcoe, Muskoka. It has occurred in the city of Toronto. I'm aware of more than one incident that's involved hockey specifically, hockey games, hockey teams. But it's the first time here in Simcoe, Muskoka.
Okay, and the monitoring dashboard, when it comes to hospital capacity, did RVH's 70 beds impact those figures? Like by adding them, does it bring down capacity?
Yeah, thank you for that question. It's a very good question. We asked that of ourselves this morning, and we're investigating that.
Okay, thank you.
You're welcome.
Thank you, Erica. Chris Simon from the Barrie Advance, are you on the line?
I am. Thank you very much, Dr. Gardner. Province announced probably about an hour before you that it's only 98,000 ID now tests across the province, and his state Muskoka was. Do you have any idea how many and whether or not you potentially or hospital?
So, Chris, you're kind of breaking up. Do you mind restating it again?
Oh, I'm sorry about that. So the province, about an hour before you came onto your call, announced the deployment of 98,000 ID Now rapid assessment tests across the province, and said that Simcoe Muskoka would be getting some of them. Just wondering if you have any idea how many. The province didn't seem to know.
I'm afraid I don't know at this time. I do know that we've already had some of those administered at our assessment center in Aurelia. It's being done as a pilot so that the individuals who are getting tested can get a result in under an hour, I believe. But they actually get 2 swabs done. The second swab sent for standard testing in order to calibrate the accuracy of the rapid test. So that much I know. Otherwise, I don't know more detail about what else is coming here.
Sure. Can you talk to me a little bit about what kind of a game changer rapid testing could be for this region?
Well, at this point, people can be waiting 2 days or so for their results. If you were able to get your result in an hour, and we were told of it within the day, we could move on it that much more quickly. It would be that much less delay for potential for transmission among the contacts, maybe potentially better compliance in the interim for cases. I think people would prefer to know much sooner than having to wait a couple of days.
Thank you.
Thank you, Chris. Alison Brownlee from Muskoka Region, go ahead, please.
Yes, thank you. Orange status for Simcoe Muskoka. Why must Muskoka be included in orange status? Is it punitive or protective?
Well, it's certainly not punitive or meant to be punitive. It is more protective. I would readily agree that the requirements create hardship for some businesses, for sure. If you have restricted hours or restricted size of number of patrons that can be present, that is a hardship. I note that the province so far has been sticking with entire health units and not breaking them up into sub-areas. I would acknowledge that there's a very big difference in the rate of disease in Muskoka versus South Simcoe, tenfold or greater difference. And so I I can see why people in Muskoka might not want to be put in the same category. On the other hand, I am aware that there is movement of people from the south, including in the GTA, to Muskoka and Simcoe, and accessing services, and there's a potential for exposure. So this would give an added level of protection against a surge starting to affect Muskoka in the same way that it's affecting South Simcoe.
Thank you very much. And in terms of the restrictions, you did mention, or some of the questions so far have touched on a concern about potential red zone status, potential lockdown in future, all hypothetical at this point. But it has people worried because of the hardship that we saw in the first wave, in the first lockdown that we experienced here. Have you seen any progress in terms of the supports that may be available to community members, whether those are people stuck at home, people without work, people who need access to services or socialization can't get it? Any progress that we would be able to see if we do come to a second lockdown?
Well, one of the things I would note is that the framework itself has been crafted to seek to keep those open. So like social services and community services and agencies that provide community services and the locations that they are in, like within malls or within libraries or within community recreational facilities, are all open and would remain open even in lockdown. So that is an adaptation meant to reduce the harm associated with the measures that was absent, I would say, in the spring. The spring things happened very quickly, and there wasn't the time to really think through and craft a framework with this kind of thinking in mind. So that would be, I think, an example or a citation of a way in which this time around it's meant to reduce the harm associated with these losses. The province and the federal government continue with the supports that they have. Many people in public health feel that they need to give better protection for employment, loss of employment or illness, sick pay while they're off. We want to get away from the incentive to return to work while you're still sick because of the potential loss of income. So that is something that many of us have advocated for as a potential improvement.
Thank you very much. I really appreciate it.
You're welcome.
Thank you, Allison. Brett Glover from Barrie 360, go ahead, please.
Well, thank you very much, Dr. Gardner. I hope you're well. I'm hoping to circle back to the hockey outbreak. I'm told that there were 9 members involved, all youth under the age of 17 and all from Barrie. Is that something you can confirm? I know your hands are kind of tied with these types of details.
At this time, I don't want to because my team are looking into it, so I don't have a figure for you at this point. We will get one for you when we have it firmed up.
All right, fair enough. 2, I want to speak to you about enforcement. A lot of people are saying it's really lacking. There isn't much compliance in many COVID-related rules because there isn't any enforcement there. How do you feel about the enforcement in Simcoe, Muskoka?
Well, there's no doubt that for the most part, we depend on people's goodwill. We don't have the resources to enforce everywhere compliance. As a health unit, we are happy to take calls of concern, and we will follow up with establishments that fall within our mandate to respond to, like food establishments, starting with a phone call and using an educational approach and then working forward from there. If we have to, we'll issue an order or in theory a ticket, although we've not actually fined anyone. But we have certainly issued orders against people for non-compliance. And there are other settings in which we would be working with the police and advising whether or not they would respond, or bylaw officers. But I think at the end of the day, there are limited resources to be able to enforce, and we really do depend on everybody understanding that we're in this together, that we flatten the curve together, and everybody needs to be part of the solution.
Thank you.
You're welcome.
Thank you, Brett. Martin from Muskoka today. Go ahead, please.
Oh, hi, Doctor.
Hello?
Yesterday and today, the province said there was some kind of glitch in the numbers. Was Simcoe, Muskoka affected by that?
Our numbers, I feel, are accurate. They've been the result of our own data intake and entry and review. We do have epidemiologists on staff who are highly capable and very diligent. So I feel confident in our own numbers.
Good. Regarding your earlier statement, so you're going to send a letter, I'm not sure it's a proper term for letter because you discussed letters to the public, but a letter or an email to the province recommending that people from red zones not migrate into orange and etc. yellow zones there. You're a member of the select table of medical officers of health who recommend or who advise the senior members of government. Are you confident that letter holds any weight or that it will be abided by on your recommendation from the province's side?
So I guess I need to clarify myself. I'm sending a letter to our municipalities advising...
Well, I thought you were sending one also to the government or province. I certainly didn't mean to say that or give that meaning. I have communicated to the province, verbally or otherwise, on this topic, and I'll continue to do so. I certainly think it's very important that they take the strong advice that they put in their framework and they make it well known, that they do a lot of public communication about it, and that they consider what else they could do to strengthen in compliance with it. So do you think it'll come true or not?
I really do not know. I know what I can do, which is advise my municipalities and communicate my views to the province. But I don't have any direct control about provincial decisions.
Okay, thanks.
You're welcome.
Thank you, Mark. Adrian Presidia at MyFM. Go ahead, please.
Thank you. I just have a quick question about the reopening of long-term care homes. Like, what types of rules or regulations can be expected once they're reopened? I guess not to the public, but will there be different expectations for staff and I suppose families who want to visit in some capacity?
So I gather you would be referring to restrictions in place now, and if at some point in the future when things are safer, what that would look like? Is that essentially what you're asking?
Well, that too, but I'm thinking more along the lines of the ones that have been declared an outbreak.
Oh, I see.
And then once the outbreak is lifted, will there be different rules in place?
So facilities that are in outbreak can still, unless otherwise stated by communications from the facility, allow essential visitors to provide assistance and care for the residents. So an essential visitor is someone who's chosen specifically for each resident. Each resident can have up to 2 family members that are chosen for that purpose. One can visit at a time, and they abide by the infection control practices and personal protective equipment, and to have the necessary testing done on an ongoing basis, being negative for COVID-19 in order to come and spend time with their family member and to provide some assistance and care. So even an outbreak that is allowed unless the facility chooses otherwise in order to address what they're dealing with at the time. So I anticipate for these facilities an outbreak that once that's over, they would continue allowing for essential visitors only, but not general visitors. And there's two things in place now that would require that restriction. One is a letter that I issued, an order that I issued, I think about a month ago now, making that requirement. But the other is that the province in the meantime has actually increased its restrictions so that areas that are in orange, such as ours, have that same restriction in place. So I anticipate people will be able to visit, but only as essential visitors, no more than one at a time, two chosen individuals per family member, and that will continue for the foreseeable future until we get to a point where we've got disease levels low again.
Okay, I think that's all. Thank you.
You're welcome.
Okay, thank you, Adrian. Mike Arcelides from CTV, do you have a question?
Always. Doctor, good afternoon. How are you?
I'm doing okay. How are you doing?
Good. What would you say right now is the main driving force in the rising infections? Does it remain? I know in that letter you sent a statement to residents that it appears that household clusters are, the branch with which this extends into the workplace and the schools and vice versa. Would you say that's the main driver of this resurgence?
I think it's an interplay. I think that the work environment has contributed to transmission. I think people's social lives have allowed for connection that shouldn't happen. They need to be physically distanced. I think travel for work or social purposes into the GTA, where there's higher rates of disease, has been a major driver in the southern portion of Ontario, of our territory that is hardest hit. And then there's the vulnerability of the household. So the people catch it at work or through the travel to an affected area, through socializing. And then they bring it into the home and it transmits in the home. And delay in testing for cases in the home, we now realize is a contributor as well. If people are waiting a while before they go and get tested and they don't isolate from their household members, they're putting them all at risk. So interplay of factors happening between the work environment, particularly travel into the GTA, the broader social connections, delay in testing when you get a case, and then the spread in the home.
I decided, foolishly or not, to venture to the Georgia Mall this weekend, and it was rammed. Everywhere you go, there were a lineup of 10 to 15 people waiting to get in, even stores that never have anyone in them. So, to what extent do we know, based on, I guess, tracing and just maybe having evidence in the mall of folks coming from lockdown areas to our region to shop and to eat and do things they cannot do in their neck of the woods?
I don't have data on it, but I've had many examples of it communicated to me by email, verbal communication. People are aware of situations, or they've noted people who, through conversation, are from the GTA, from the gray and the red zones, and who gone out of their way to shop up here because we're still more open than they are there. And might even be planning on doing so on an ongoing basis, and instances where people have chosen to come up here to rent time on the ice to play hockey with their fellow hockey playmates, and they've done so because they can't do so back in their municipality, and that I've heard of that as far north as Muskoka. So I'm aware of many examples, which is part of the prompting for my letter of advice to our municipalities.
So what do we do? What's the solution here? Do we put up a big wall on Highway 9? Or?
Well, it's not a straightforward and easy thing. Indeed, there have been countries that have been extremely strict about this, such as the outbreak in Victoria State in Australia. People weren't allowed to move, outside of the city of Melbourne, for example. So there are places that have been very strict about it. I do not believe that Ontarians would be inclined that way, that the government here would be inclined that way. So I think it would come down to strong messaging, and it would be preferable if we had strong messaging from the province that used communication channels to really push that message. our municipalities and asking them to look at actually disallowing use for people that are from those areas with regards to their facilities. I would support businesses that would choose to not offer service to people from red or green zones. Other than that, I think it's tough. I think it's going to be a hard thing to stop. If in fact we progress again and have an increase in cases, well, then we will be in red, right? We'll have further restrictions. And that might have an impact on people coming here because it'd be the same restrictions. Certainly if we end up in gray, we'll have restrictions, and that would have an impact on people choosing to come here.
Thank you very much.
You're welcome.
Okay, thank you, Mike. Is Sean Gibson from Barrie today on the line? Okay, let's go back to Erica Ankle. She has a follow-up question.
Hi, yes. Given that you've made those recommendations to municipalities about the recreation facilities, do you also have any advice to ski resort operators in the region, which are sort of like recreation facilities and typically draw crowds from all over? I'm picking up Blue Mountain Resort, Horseshoe Valley.
So I would imagine that a very large portion of their business would actually be from the GTA, from red and gray areas. And the province's official advice is that people not travel out of those areas except for essential reasons. And recreational skiing, though pleasant and healthy and enjoyable, is not essential. And I first off recommend that people from those areas not come up here for that purpose at this time. This is the pandemic of the century. This is not a normal time. I recommend strongly that they not do so. And I would certainly support resorts that would choose to disallow them from doing so.
Okay, thank you, Erica. I'll just circle back to Sean Gibson from Barrie today. Are you on the line? Okay, is there anyone else on the line who I may have missed?
Dawn from Muskoka.
Oh, go ahead, Dawn.
Thanks, Kathy. Hi, Dr. Gardner.
Hello.
Just to follow a little bit along the line that Erica started on, we know that people from red and lockdown areas are traveling into other regions, and you're making a recommendation to municipalities to disallow that, at least in their facilities. Would you go as far as recommending rather than just supporting businesses that would do the same?
Yes, I would go as far as to recommend it.
And would there ever be circumstances, do you think, where the province might actually make that an order? I don't think that's within your mandate, or perhaps it is. But could we reach that point where businesses might be required to turn people away?
I think it would be hard for them to do that. I think they'd get a lot of pushback, a lot of concern for it. It would be a difficult thing for them to do. I have raised the question about enforcement and whether there's a potential for it, but I think it would be difficult for them to do. I have cited that there have been places in the world that have been much more stringent about travel restrictions, but at this point, I wouldn't expect that the province would be doing that.
Thank you.
You're welcome.
Okay, thank you, Dawn. So at this point, I'd just like everyone to know that next week we will not be having a media briefing. However, if you want to forward your questions through to our media inquiry line, we will do our best to make sure they are answered. And then if need be, you can have someone to speak to. So at this point, I'd like to bid you a good afternoon, and we will see you in December.
Goodbye, everybody.